I'm going to talk about vital signs, which includes heart rate, respirations, blood pressure, skin signs, and pupils. First, I'm going to go over what the difference is between a sign and a symptom. A sign can be categorized as an objective fact. An example of a sign is heart rate or respiratory rate. A symptom, on the other hand, can be categorized as a subjective feeling. An example of a symptom is feeling nauseated, feeling like you have a headache. There's an important distinction to remember between what a sign is and what a symptom is. Here I have a brief chart that gives some examples of normal ranges for the listed age groups. So, what is considered normal depends on several factors. Including the patient's age, the patient's health, and the circumstance that the patient is in. So in this chart, I only have listed normal vital sign ranges for infants between 6 to 12 months old, children between 6 to 10 years old, and adults. And keep in mind these vary depending on the age groups. So for example, for an infant, a normal heart rate is between 80 to 140 beats per minute. For a child in this age group, a normal heart rate is between 70 to 110 beats per minute. And for an adult, a normal heart rate is between 60 to 100 beats per minute. For an infant in this age group, a normal respiratory rate is between 20 to 30 breaths per minute. For a child, the normal respiratory rate is between 15 to 30 breaths per minute. And for an adult, between 12 to 20 breaths per minute. For infants and children, the normal systolic blood pressure is calculated using this formula, 80 plus 2 times the age in years. For adults, the normal range is about 120 to over 80, 120 over 80. Pupils, there is a saying called Pearl. Pupils are equal and reactive to light. And when assessing skin signs, you assess color, temperature, and condition. I'm going to go through these vital signs and give some examples. So, are the patient's heart vital signs within normal range? When assessing the heart, you assess the rate and quality. Is the heart rate slow? Is it fast? Is the heart rhythm regular? Is the rhythm irregular? Is the force strong? Or is it tready, which means weak and thin? So I'm going to go over some examples, but I'm only going to cover the heart rate. Say your patient is an 8-month-old infant with a heart rate of 60 beats per minute. Is this within normal range for an 8-month-old infant? Referring to the chart, you see that no, it is not within the normal range. It is below it. This condition is referred to as bradycardia. Bradycardia is a condition in which the heart rate is below the normal range. Say your patient is a 7-year-old child with a heart rate of 140 beats per minute. Is this within normal range? Referring to the chart, you see that it is not normal. It is above the normal range. This condition is referred to as tachycardia. Tachycardia is a condition in which the heart rate is above the normal range. And say your patient is a 30-year-old adult with a heart rate of 90 beats per minute. Referring to the chart, you see that yes, this is within normal range for an adult. Below 60 would be considered bradycardia for an adult, and above 100 would be considered tachycardia for an adult. Are the patient's respiratory vital signs within normal range? With respiratory rate, you also assess, is the respiratory rate slow? Is it fast? Is it regular? Or is it irregular? Is the effort labored? Agonal? Agonal breaths are gasping breaths for air. Is the depth adequate, or is it shallow? So again, I'm only going to cover rate, and I'm going to go through examples. Say your patient is an 8-month-old infant with a respiratory rate of 15 breaths per minute. Referring to the chart, you see that this is not within the normal range. It is below it. This condition is referred to as bradypnea. Bradypnea is a condition in which the respiratory rate is below the normal range. Say your patient is a 7-year-old child with a respiratory rate of 40 breaths per minute. Referring to the chart, you see that this is not within the normal range. It is above it. This condition is referred to as tachypnea. Tachypnea is a condition in which the respiratory rate is above the normal range. Say your patient is a 30-year-old adult with a respiratory rate of 20 breaths per minute. Referring to the chart, you see that yes, this is within normal range. Particularly dangerous for an adult is bradypnea below 10 breaths per minute, or tachypnea above 24 breaths per minute. Blood pressure is given as systolic over diastolic, unless you palpate systolic blood pressure, in which case it is given as systolic over PELP. For infants and children, you use the formula 80 plus 2 times the age of the patient in years, and the result is the expected normal systolic blood pressure. So, for example, say your patient is 1 year old. You would take 80 plus 2 times 1, which is 80 plus 2, and the result is 82. Say your patient is 7 years old. You take 80 plus 2 times 7, which is 80 plus 14. The result is 94. For adults, the standard reference point is 120/80. However, this can vary and still be considered within normal range. Systolic blood pressure greater than 150, or diastolic blood pressure greater than 90 is hypertensive. Hypertensive refers to high blood pressure. Systolic blood pressure below 90 is hypotensive. Hypotensive refers to low blood pressure. Do these skin signs or pupils indicate abnormality? Normal color varies with skin signs, but generally pink nail beds and inner eyelids are considered normal. Abnormal color, pale, is associated with poor circulation. Cyanotic, which is a bluish color, is associated with a lack of oxygen. Jaundice, which is a yellow color, is associated with liver problems. And mottled or blotchy is associated with shock. Normal skin temperature is warm as opposed to hot or cold. And normal condition is dry as opposed to moist or clammy. Pupils, remember the acronym PEARL. Pupils should be equal. In normal lighting, they should be at midpoint and they should react to adjust to light changes. So in decreased light, the pupils should dilate. And they do this to let more light in. In increased light, the pupils should constrict. And they do this to block excess light. Several things can affect the pupils, like drug use, prescription eye drops, brain or eye injuries. So keep that in mind when assessing them. Also, like I mentioned earlier, what is normal depends on several factors, including age, health, and circumstance. So, for example, a person that is an athlete may have a lower blood pressure than a person who has coronary artery disease. A person who just got finished exercising is going to have a higher heart rate than somebody who has just been relaxing watching TV. So keep these factors in mind when assessing vital signs. And that concludes this video.